It is no secret that Zika cases have been confirmed in Belize, but we did not know how many. Since the start of the year, at week 38, there are 46 confirmed cases of the virus. While Toledo has the highest rate of 2 per 10,000 persons, Belize district has 21 of the 46 cases of Zika in the country. All districts except for Corozal have at least one confirmed case of Zika. For some time now, the Ministry of Health has been focused on pregnant women and those expecting to get pregnant because Zika, which can also be sexually transmitted, can have adverse neurological effects on babies. The Ministry of Health has placed its focus on 3 specific groupings.
So when we look at the numbers here, we have 581 suspected cases. Of these, 305 have actually been screened, which means a blood sample or a urine sample has been collected from these persons, which represents 52.5% of all suspected cases being screened. Of these 305 tests that have been done, we have received 177 results, which represents 58% of all samples taken, which means we are still pending some results now. Of these 177, now we have 46 positive cases, which is 26%. So far we have that as our positivity rate.
The abnormal smallness of the head due to incomplete brain development, also known as microcephaly, is most popularly recognized as the main effect of Zika. The facts show that 6 pregnant women have Zika, 5 in the Cayo district and 1 in Belize district. 3 have already given births. The babies so far have not exhibited any conditions of microcephaly or other malformations.
The surveillance of the effects on exposed infants has now expanded from not only microcephaly, but to other congenital malformations related to Zika, such as genitourinary, cardiac and digestive systems, hearing and visual abnormalities. The scope of the syndrome will expand as further information and longer follow-up of affected children becomes available. There is no treatment, there is no vaccine against Zika virus. A lot of the preventive measures that are being recommended can be applied to women that are not pregnant and women during pregnancies.
But there are multiple issues facing the health system because there is a huge delay in terms of getting results of Zika tests, and then there is the possibility that the Guillain-Barré syndrome could surface as a result of Zika.
Countries that have had Zika have seen a spike in a thing called Guillain-Barré syndrome, where people get progressively paralyzed because the nerve go bad. The Zika affects the nerve tissue, and the nerve go bad, and they gradually get weaker, and they have pain, and they can have numbness and some other things. So Guillain-Barré is something that we are looking for, because in every country where we've had spikes of Zika, we see spikes of Guillain-Barré. There was a graph up there. Normally here in KHMH, we see between 5 and 7 Guillain-Barrés per year. So if all of a sudden we start to see more, then we kind of have to start to figure out there must be something going on.
Zika preparation started in early February, and the ministry immediately sprung into action with a preparedness plan that deals with sensitization of the healthcare system, and vector control measures were further developed in the 9 municipalities across the country.
We started, as with other countries, to look at funding sources, external funding. Several proposals were written and submitted to various agencies. The success was minimal, but still somewhat positive. We began to develop partnerships with various stakeholders, PAHO, UNICEF, the BTIA, the Mexico Institute of Public Health, CARFA, the Gorgas Institute in Panama, among many others. ULV spraying on a whole is ongoing and basically has not stopped since last year. Normally we would do ULV spraying during the rainy season, or sometimes we would start around May and end around October, November. But over the past 2 to 3 years, we've been doing it almost all year round, and it has incurred significant costs.
The Ministry of Finance has approved insect repellents and insecticide bed nets that are being distributed free of cost through the various health facilities. According to Chief Operations Officer Kim Bautista, hundreds of thousands of dollars have been invested, but the community has to participate for there to be significant results.
The Ministry of Finance has also approved for countrywide indoor residual spraying in key hotspots at a cost of $90,000. And so if you basically look at the investment, excluding the salaries of the 62 staff countrywide and the fuel and all of this, I will say that it is well over $600,000 just since the start of the year.
So the take-home message for healthcare providers and for individuals, as Mr. Bautista was alluding to, that it's not only an institutional effort, but it requires an individual effort, is that we should make all efforts to prevent unplanned or unintended pregnancies.
The results of 42% of the samples sent to CARFA are still pending. Duane, Moody for News 5.